lower incisors, the resultant force was not pure intrusion. The resultant force vector was retraction and intrusion. And Align realized this is one of the reasons that it's so difficult to intrude the lower incisors. So what they did is they wanted to change this vector for lower incisor intrusion by adding this pressure area here in the lingual of the lower incisors to change this vector to a more true intrusion along the tooth axis. So that's why they added the pressure area for lower incisor intrusion. And this feature is available for lower incisors and upper lower incisors and lower canines. You can't really see those pressure areas on the lingual of the incisors. You can only see on the prescription sheet like this. It's indicated here that the pressure areas have been applied. And I would like to discuss about the G8 protocol launched in 2021. And they also came up with a special feature for lower incisor intrusion, and it's aligner activation. So I said aligner activation is the change in the shape of the aligner. So what they did is, so they're trying to figure out why it's difficult to intrude the lower incisors. And they realized that when the incisors are not level, when they're like, their level is all different, different forces need to be applied to each tooth. So they calibrated the amount of intrusion force that is applied for each tooth. So let me explain here. This is my patient. This is a superposition of before and after treatment. So you can see that the lower lateral incisor has more intrusion plans than the lower right central incisor, right? But this difference is so small that this force is too small to intrude this lower right central incisor. But this one has more discrepancy, right? So this tooth will have more intrusion force than this tooth. So it will be easier to intrude this tooth than this tooth. So they realized that for teeth that have very small amount of changes required, they increase the force. So in the clean check, they over-engineer intrusion of these teeth with small amounts of changes. So that's internal clean check, I guess. So it's not clean check, internal software. So they calibrated the intrusion force that these teeth will receive enough amount for intrusion to be habit. So that's what it's all about. And we can see that this kind of aligner activation is applied when we look at the tooth movement table here. Sorry, here, the lower incisors. And if you magnify, you see this blue shaded area. This means that there has been aligner activation planned on these teeth, and they don't really tell you which kind of aligner activation, but we can see from the tooth movement table that because we have intruded here, right, that aligner activation is designed. So it was this patient. So let me show you how the case went. So we are distalizing. You can see that her premolars are distalized. Distalized. Very well. Now her molars touch one. And you can also see that at the same time her upper incisors are confined because of the reaction force. And also because her incisors are corrected, the overbite, the deep bite is corrected also. So if you compare with the initial, the deep bite has been normalized, right? So the reason for this patient's deep bite was the incisor torque. So if we normalize the incisor inclination, the deep bite is automatically resolved. Another patient in her 50s, severe deep bite. You can't even see the lower incisors. Also, she's class 2. So if you see this patient and you only plan for intrusion of the upper and lower incisors, you will not be able to correct her molar class 2 molar relationship, and what you'll end up with is a large overjet. And that large overjet with normal overbite, you will not be able to have a stable occlusion, right? So it's important to diagnose and see that you will also have to correct the sagittal as well as the vertical problem. So she's class 2, severe deep bite, extruded upper and lower incisors. This is a clean check. Even if they have the GA protocol to intrude the lower incisors more effectively, you also have to over-engineer. So I try to do the clean check to make the patient almost edge to edge, almost like open bite. You definitely have to do this because otherwise you're not going to be able to correct the deep bite. So this is a clean check. And I delivered the attachments. And you can also see here on the tooth movement table, here the lower 6 anteriors, you see that the amount of intrusion is a lot here, right? 2 millimeters, 4 millimeters, 4 millimeters, 3 millimeters, and there are black dots here. And you see the blue shaded tooth numbers, which means that there have been aligner activation designed on these teeth. And also in the upper incisors are blue shaded, which means that aligner activation is built in there. And also there is power ridges to correct the torque of the upper incisors. So the patient is wearing the aligners, and I'm also distalizing, and this is the final. Yeah, you see that I planned for almost an open bite, but this is the result. This is the result. This is the facial photo after treatment. Panoramic radiograph. This is her Ceph before treatment. This is after treatment. So you can see that the lower incisors and the upper incisors inclination is normalized. And this is a superposition. A lot of intrusion in the lower, right? As well as upper. And this is retention, very stable. And I'm sure many of you know that it's very difficult to retain a deep bite case, right? So what I do these days, I use VAO retainer because it covers the whole tooth surface, right? And it's really good for vertical control. So in deep bite cases, I really recommend that you use VAO or any type of ABP retainer, type of retainer, anterior bite plate. Another deep bite case. Severe deep bite, missing teeth, crowding, transverse problem here. And you can see his incisors are very upright, and this is one of the reasons for the deep bite. And as we normalize the incisor inclination, the deep bite will correct. Right? Missing teeth. This is a clean check. I'm normalizing the incisor inclination and at the same time intruding both upper and lower incisors. Also, over-engineering, I tried to make it almost an open bite patient.
Chúng ta sẽ tạo ra một cái clean check mà cắn hở luôn.
And this patient also is class 2, so I'm trying to correct the molar key. I'm proplining the lower incisors and intruding at the same time. And I'm having the patient wear class 2 elastics.
Bệnh nhân này cũng được mang thùng hạng 2.
Aligning
Sắp đều răng
and preparing space
và tạo
for
khoảng cho
implants.
đặt implant trong tương lai.
And another feature is the bigram. You can see here. Bigrams for deep bite correction. So this is the start of treatment.
Đây là bạn trước điều trị và
I was trying to
tôi thì cố gắng để
align these molars because he had a kind of a scissors bite.
Vì là bệnh nhân có cái biểu hiện tình trạng cắn kéo.
And I'm also trying to align the molars, lower right molars, with the NPA appliance, mini tube appliance. And I take a lateral set, a progress lateral set, and I see that now his upper and lower incisors have normal inclination.
Đây là cái phim lúc kết thúc điều
And
trị thì chúng ta đã
this is the
tạo được
superposition of initial and mid-treatment.
và trong hình.
So his incisors are normalized,
Đây là cái
and
so
deep
sánh.
bite is corrected,
Chúng ta đã
and this is another additional aligners. I want to intrude more,
Tôi muốn lục đúng thêm
and power ridges are placed,
và đặt thêm cái bow ridge.
and you can see I've over-engineered
Và tôi cũng chỉnh lố
to almost an open bite.
những cái răng, những cái đồ cắn tủ về thành cắn hở.
And you can also see here that the lower incisors show blue colors here, right? And this means that the GA protocol has been applied.
Có nghĩa đó là cái gói G8 đang được áp dụng trên các răng này, gói G8 là kích hoạt khay đó.
Okay, the lower incisors first, and then canine, and then
Thì các răng
molars
ở cửa nó sẽ
sequentially.
lúng trước và sau đó tuần tự tới răng nanh lúng
And
và
I
các răng
have
cối.
the bite ramps
Và tôi có cái
with the
bài ra
palatal.
ở mặt ngoài, cái bow ridge ở mặt ngoài và vai ra ở mặt trong của bệnh
And I
nhân.
also have aligner activation in the upper incisors.
Và hàm trên cũng có cái kích hoạt khay ở trên cái răng cửa.
And his bite is getting shallow.
Thì chúng ta sẽ thấy là cái khớp cắn của bệnh nhân nó cũng được mở ra từ từ.
I'm trying to settle his bite.
Và sau đó thì tôi cố gắng là gài khớp cái phần răng
Fix
cối.
retainer placed.
Và sau đó thì gắn
And
cái
I'm trying to settle
duy
the
trì cố định
posterior
cho các răng cửa.
And this is the final
Và
result.
đây là cái kết quả cuối cùng.
And because I want this to be very stable,
Tại vì là
I plan for a retainer, removable retainer with an anterior bite plate here so that it
đã
will
làm
relax.
cái cụm như là
So this is 2021, 2022, but nowadays I use Rivera
đây là cái
retainer.
ca mà tôi hiện xong vào năm 2022.
This is
Nếu mà bây giờ
an
tôi có ca
treatment,
tương tự thì tôi sẽ cho bệnh nhân mang Vivera để mà hoàn
very
toàn giải phóng
stable
cái
last
mặt
year.
nhai cạnh cắn của các răng để
And
đảm bảo là
set
không có
before
cái
and
cắn
treat
sau
after, before and after.
cắn sau.
Superposition,
Ở đây là
a
cái
lot
chọc
of
hình của bệnh nhân
intrusion,
trước và sau
especially the lower
và tạo
incisors.
ra rất là nhiều cái lúng răng cả tuyệt đối lẫn tương đối. Trải lại cái trục
And
răng.
this is after his implants and
Và sau khi mà
bridge.
bệnh nhân làm lại cái implant và
Very
phục
stable.
hình khớp cắn rất là ổn định.
And last